Hello, and welcome to another vlog. This week's theme is respiratory therapy. I'll be releasing a video on Thursday in which I talk more about this week's topic, so be sure to subscribe if you want to see that video. Today, however, there's a couple of things that I'd like to talk about. First, I'd like to talk about some green initiatives and how they affect people with disabilities, and I'd also like to talk about the different types of respiratory therapy and how they work. So, let's jump right into it. So there are a lot of green initiatives with the goal of reducing waste, and I think that this is a very noble goal because I want to help the environment just as much as the next person. The unfortunate fact, however, is that a lot of these green initiatives are unintentionally harmful to people with disabilities because they treat accessibility as an afterthought. One such movement is the recent anti-straw movement, which basically aims to eliminate waste from disposable straws. Now, it is true that we do use and throw away a lot of straws. Anytime you go to a fast food restaurant and order a drink, they'll usually give it to you with a straw, and a lot of other restaurants and places will give you straws, and then there's a lot of people who use them at home, and all of these straws end up in the waste, which is very harmful to the environment and a lot of other animal life. So it is very important to reduce that waste. Now, the anti-straw movement is very extreme in the sense that the goal seems to be to completely eliminate straws, because a lot of people see them as an unnecessary luxury. However, what the anti-straw movement overlooks is the fact that there's a lot of people with disabilities who rely on straws every day, particularly those with limited functionality. So banning straws would unnecessarily punish people who rely on them. I know right off the bat it does seem like the logical answer is to eliminate things that create waste, but I think a better solution is, instead of trying to completely eliminate and rid the world of wasteful products, to find green alternatives for those products that don't produce as much waste. So when it comes to straws, I think a good solution is reusable straws. There are a lot of options for when it comes to reusable straws. There's metal straws and glass straws in particular that you can buy and use as many times as you want. You don't have to throw them out when you're done with them. Now, this is something that a lot of people in the disabled community have been very vocal about, because not everyone in the disabled community thinks that just reusable straws are the right answer. They have some concerns. So I want to address some of those concerns now, because I have been using reusable straws, metal straws, for about the last year, and I find they work very well for me. Now, of course, I can't speak for everyone with a disability. Everyone has different needs, and so what works for me might not work for other people with disabilities, but I do just want to address some of those concerns. So one of the biggest concerns that people with disabilities have about the reusable straws is that many people with disabilities need bendy straws, and reusable straws, metal ones in particular, do not bend. Now, this is true, that a metal straw is very sturdy, so it isn't going to bend. That being said, you can get, as you can see here, you can get bent metal straws. Now, these aren't as flexible as a plastic straw, which, definitely has its limits. But if you do need a straw that's bent and you want to use reusable straw, there are options out there. Another concern that a lot of people with disabilities have in terms of the straws, the reusable straws, is cleaning. Because obviously, if you're going to be using the same straw over and over again, you need to clean them. Now, most reusable straws come with cleaning brushes that you can use to clean out the inside, and a lot of them are also dishwasher safe, right? So for me, cleaning isn't that much of an issue. Maybe for some people with disabilities it will be, but for the most part it seems like they build these straws with cleaning in mind. And usually when you order the reusable straws, you'll get a pack of 4 or 5, so you don't have to keep using the same straw over and over again. You can swap out straws as needed. The next concern that a lot of people have is to do with the taste. right? People are worried that if you use a metal straw, it might cause your food to have a metallic taste. Now, in my experience, this doesn't happen. I've never had any drink that has had a metallic taste because of the metal straws that I use. At least I haven't. Most of these straws are made with food grade stainless steel, and I see no reason why you'd have to worry about a metallic taste because there are a lot of other food handling products that are made out of metal. For example, pots and pans and cutlery, and people don't usually complain about getting metallic taste from those things. So, I don't see that as an issue. Again, this is all in my personal experience. Now, the last issue, which I can see being a problem for some people with disabilities, especially those living on fixed income, is price. Reusable straws can be a little expensive, and some people with disabilities, especially those who are unemployed and live on a fixed income, might not be able to afford them. Now, the advantage to using reusable straws is they don't have to be repurchased every month like disposable straws do, but they do cost a lot more upfront. So maybe the solution to this is if countries like the United Kingdom do go through with their straw bans, to just maybe subsidize these reusable straws so that people who need them can afford them. Right, so again, in my personal experience, the reusable straws like this one work fine for me. That might not be the case for everyone with a disability, but my best advice for people thinking about using reusable straws who are hesitant is give them a shot. Don't knock it till you try it, because you might be like me, go into it, a little hesitantly, and then realize that these are actually quite useful. Now I'm going to put the straw back in my drink where it belongs, and I'm going to move on to the next thing that we're going to talk about today. So, the next thing that I'd like to talk about is the different types of respiratory therapy. So, I'm going to talk about that briefly. Now, I want to stress that I am not a doctor, so the things that I say in this video are not a replacement for professional medical advice. If you're having any issues related to your respiration, go see a doctor and get their advice. But I'm going to talk about some of the different types of respiratory therapy, particularly for people with neuromuscular disorders and spinal cord injuries. This doesn't apply to everyone with respiratory health issues. There's many different types of respiratory therapy, and it would probably take me hours and hours to cover all of them. So I'm just going to focus on the ones that are specific for people with neuromuscular disorders and spinal cord injuries. So, to start, there's many different types of respiratory therapy in the form of exercises. There's a variety of different breathing exercises that people can do to help maintain their respiratory health. One of the common ones is called breath stacking. So breath stacking, essentially what you do is you take 3 successive breaths and then release. And you tend to do this 2 or 3 times in a row. And the purpose of doing the breath stacking is to try and fill your lungs up with as much air as possible. So again, that's you take 3 successive breaths and then you release, and you do that 2 or 3 times in a row. Now, there's another breathing exercise called paced breathing. So it's called paced breathing because you basically pace yourself when you breathe. You breathe in for 4 seconds, hold for a few seconds, and then release for 4 seconds. And again, the purpose of this is to try and fill your lungs up as much as possible. Then there's something called a lateral stretch. Now, a lateral stretch is very similar to the breath stacking. The main difference is that when you do the successive breaths, you lean from side to side. And the purpose of doing this is to kind of stretch those abdominal muscles to help, again, fill up your lungs as much as possible. And a lot of times when people do exercises like breath stacking, they use something called a lung recruitment kit or an ambulatory bag. So this is what I use. Basically, it's a mask that goes on my face, and you squeeze the bag, and that fills up my lungs. That helps me do the breath stacking. right? And a lot of people with neuromuscular disorders use these ambulatory bags. So those are some of the different breathing exercises. There's also some other types of respiratory therapy that you can do similar to the exercises. There's the assisted cough. Now, the assisted cough takes on several different forms. There's the self-assisted cough, the caregiver-assisted cough, and the mechanically assisted cough. Now, essentially what you're doing with the self and caregiver-assisted cough is as you're coughing, you're pushing on your abdominal muscles to help increase your cough volume and the amount of air that's exiting your lungs. Some people are able to do this by themselves, where they can push on their abdominal muscles as they cough to generate that larger cough, but other people need someone else to help them. So a caregiver or a parent or someone like that. But there is also a third way. There's the mechanically assisted cough. So the mechanically assisted cough uses a device known as a mechanical insufflator-exsufflator, which is a very fancy term for a device that helps you cough. Essentially, what it does is it pumps air into your lungs, and then as you breathe in, and then as you breathe out, it sucks air out. So it's essentially a vacuum cleaner for your lungs. And by pumping the air in and sucking the air out, that helps you release a lot more air and helps you to generate a larger cough. This is especially important for people who have the beginnings of a respiratory infection who want to prevent getting pneumonia, because for someone like me with a neuromuscular disorder who has very low lung capacity, cleaning out my lungs when I'm sick, clearing out those secretions can be very difficult. So it's very good to do these exercises to help clear out my lungs so that I don't get pneumonia, because for people with neuromuscular disorders, especially pneumonia, can be fatal. So that brings me to the next thing, which is mechanical ventilation. Now, ventilation is basically just a fancy way of saying a machine that helps breathe for you. It either helps you breathe or it does the breathing for you. Now, there's many different types of ventilators, and I'm not going to talk about the different types of ventilators, but rather I'm going to talk about invasive versus non-invasive ventilation. And so this really all comes down to the delivery method. So with invasive ventilation, the air is typically delivered via a tracheostomy. So that's a tube that goes directly into your esophagus, or your trachea rather, and pumps the air into your lungs and then sucks the air out. It essentially breathes for you. Now, some people with tracheostomies aren't hooked up to the ventilator all of the time. Some people are, some of them aren't. It really depends on that person's specific needs. And then there's non-invasive ventilation. So non-invasive ventilation, again, these machines help people breathe. But instead of being delivered via an invasive means, such as a tracheostomy, they tend to be delivered via non-invasive means, such as a mask, a nose piece, so either nose pillows or otherwise, and sometimes a mouthpiece or a straw. So that's some of the different delivery methods for non-invasive ventilation. So basically the main difference is invasive ventilation is actually in your body. The delivery method is actually invasive. It's inside of your body, whereas with non-invasive, the delivery method is external and can be removed very easily. Now, there are two types of non-invasive ventilation that I do want to mention. There's CPAP, which stands for continuous positive airway pressure, and then there's BiPAP, which stands for bi-level positive airway pressure. So as the name suggests, one ventilates via continuous pressure, whereas the other one ventilates using different levels of pressure. Now, there are two different types of ventilation, and they are used to treat different conditions. They're similar, but they are different. CPAP is typically used to treat things like sleep apnea, whereas BiPAP is typically what's used to treat different types of neuromuscular disorders. So that's just a brief overview of the different types of ventilation. So that's pretty much everything for today. You may be wondering what the two things that I talked about, straws and respiratory therapy have in common? Not a lot, but they're two things that I really wanted to talk about this week. And I think they're very relevant. Anyway, if you enjoyed this video, please hit that subscribe button and also be sure to like us on Facebook and follow us on Twitter. Anyway, thanks for watching and see you on Thursday.